Dr. Isaac Bogoch back with us to give us a primer in this, an infectious diseases specialist from Toronto. Good to see you, Dr. Bogoch. Welcome back.
Thank you. Great to see you as well, Heather.
Let's help us understand this, Dr. Bogoch. Number one, what is monkeypox?
And monkeypox is it's a viral infection, and it's endemic to parts of West Africa and Central Africa. When it is not infecting humans, it lives in rodents, and this is what we call a zoonotic infection, where it can jump from non-human animals into humans. And as you point out, there have been outbreaks in West and Central Africa. And once in a while, a case has been able to someone gets on a plane, flies somewhere distant, and there have been cases detected over the last few years, periodically in Europe or in the Americas or elsewhere around the world in Asia. And occasionally those result in onward transmission to a few other people. But what we're seeing now is a much larger outbreak than what normally happens when a case gets exported from Central or West Africa.
What are the symptoms of monkeypox?
So after someone's exposed to this virus, it usually has an incubation period of about 10 to 14 days, up to 21 days. And then people will feel a bit of a headache. They might have some muscle aches and pains. They might have some swollen lymph nodes. And then afterwards, a couple of days afterwards, you'll start to get those very distinct skin lesions. Some people say it's similar. You might hear words that it's similar to chickenpox. It is and it isn't. With chickenpox, when you see the skin lesions, those classic skin lesions emerge, they're of different ages. So some are erupting at the same time that others are receding and scabbing over. With monkeypox, it's similar to an infection that has been eradicated from planet Earth. It's similar to smallpox in that the lesions typically are all the same age. They'll usually erupt mostly at the same time, and they'll roughly be at the same level of development. And fortunately, the vast majority of people will recover from this and will do just fine. But there obviously can be people on the sicker end of the spectrum. Luckily, that's the minority of cases. And so far to date, we haven't heard of any people impacted by this that have had a more severe illness. But of course, we know it can happen.
Okay, that's good to know. I was going to ask you that. So we know it's rare. We know it's by and large not serious, but it can be. The cases that we're tracking from what we're hearing, including the man in the States in Massachusetts, in hospital but recovering well. It makes me ask, so it's gone from, it seems, from animals to human. What we know about the cases in Montreal is these were cases reported by sexual transmitted infection clinics, awaiting final confirmation. But they were the clinics that flagged this, and it seems to be in cases in Europe as well. Gay men, bisexual men, men who have sex with men. As far as transmission, what do we understand about how it's transmitted, and could there be a sexual transmission component to this?
Right. So this is very interesting as well. So we know, first of all, let's acknowledge that there's not a ton known about this. This is what we call a neglected tropical infection or a neglected tropical disease, in the sense that it's, along with many other infections that plague low-income countries, there's just not a ton of research on this. But there is some, and we do know something about this. Based on some of the outbreaks in the past and some of the studies, we know that people can get this by direct contact with some of the lesions, or direct contact with bodily fluids from infected people, from close contact with individuals, so being in close proximity for a prolonged period of time. And of course, there still are more distant contact, more distant infections. Those don't seem to be the majority, but that certainly can happen. When we talk about people getting this infection through sexual contact, what's really unknown is, was that just because of close and direct contact with the lesion, or was it actually sexually transmitted? Before we completely discard the sexual transmission, I think it's fair to acknowledge that, Ebola virus recently was found to be transmitted through semen. Zika virus as well was found to be transmitted through sexual means as well. So I think it's fair to keep an open mind on that mode of transmission, but it's based on what we know, close proximity is the main mode of transmission.
Okay. There's more online at CBCNews.ca in terms of treatment and prevention and things of that nature. Just one quick point on this before I ask one final question. I'm going to squeak in one. I noticed you've been, obviously people turn to you on these kinds of things when they're emerging. And one quote, you said, "Is this the new COVID?" You said no, emphatically. I mean, there's a lot of people going, oh, here we go again. Monkeypox, the new scourge. What do we need to keep in mind on this, Dr. Bogoch?
Yeah, while this is transmissible from person to person, it's not nearly as transmissible as some of the viral respiratory infections that we've seen. And certainly there will be more cases. There will be more cases uncovered, but this is not the same as COVID-19. What's really interesting is that the smallpox, it's very closely related to smallpox, and people over a certain age have been vaccinated for smallpox, and there's likely some very significant cross protection of that vaccine, the smallpox vaccine, although that protection might wane with time.